Welcome back. Lung cancer can go undiagnosed for a long time because symptoms can be ignored or pushed aside as something else. Joining us this morning is Dr. Douglas Kunzweiler to talk with us about the types of lung cancer, the symptoms to look out for, and how to reduce your risks. Thanks for being here again, Dr. Kunzweiler. So there are two main types of lung cancer, as I understand it. Can you start out by just talking about what those two types are?
Yeah, there are several different types of lung cancer, and that's based on the type of cell that becomes cancerous. But they are grouped into two main groups, and those are called small cell lung cancer, or sometimes it's called oat cell. The small cell lung cancers tend to be more aggressive, they tend to spread more quickly, and they are more resistant to treatment. The other group are called the non-small cell lung cancers, and so all the others fall into that group. And they tend to grow a little more slowly and generally tend to be a little bit easier to treat. Okay,
what generally puts a person at risk for lung cancer?
Well, the number one risk is cigarette smoking. Approximately 85% of all lung cancers are found in people who smoked. Cigarettes, cigars, pipes, doesn't matter. There are other risk factors. You can still get lung cancer even if you were never a smoker. Exposure to radon gas, which is a radioactive gas found in this area, can be a risk factor. Asbestos, especially if you worked around asbestos, is another big risk factor. Secondhand smoke is an important risk factor. If you lived in a house with somebody who was a smoker, that increases your risk. And there's probably a genetic component as well. If somebody in your family had lung cancer, you might be at somewhat increased risk.
Okay, so if those are the increased risks, how do you decrease those risks?
Well, the primary thing is if you are a smoker, to stop. And one thing that we like to stress is that it's never too late to stop. If you quit smoking, your risk begins to go down immediately, so that's important. You should have your house tested for radon gas, and there are cheap kits you can buy that will check your house. If it turns out that you have high levels of radon in your house, there are things that can be done, mostly ventilation type things, to lower that risk. Try to avoid asbestos products, and there are government agencies that can help you detect that and help you ameliorate those risks if you have it. But far and away, stopping smoking is the big thing.
So if someone is or was a smoker, or there is something else in his or her life that may put them at risk, is there a screening that a patient can go get, or how do you get tested?
You know, for a long time we've been looking for ways to screen for lung cancer, and it's really not very practical. However, if you are at high risk, that is if you have a long smoking or heavy smoking history, or if you worked around asbestos, then we recommend a low-level CT scan. It's not recommended for the general population, but if you have those particularly high risk factors, then you should get a CT scan to look to see if you have a tumor.
Okay, so those people who are not high risk, what are the symptoms they should look out for so that they should go see a doctor?
Okay, well, one of the problems with lung cancer is that it often doesn't present with symptoms until late in the disease. But the things that commonly we see are, first of all, prolonged cough. You know, usually you get a cold or a bronchitis and you have a cough for 10 days to 2 weeks, but a persistent cough that just doesn't go away, you need to have that checked out. If you're coughing up blood, that's an ominous sign, so you should see your primary care provider if you have that. Unintended weight loss can be a symptom of lung cancer, fatigue, a change in your exercise tolerance. So if you suddenly become short of breath doing things that normally wouldn't bother you, you should have that checked out. Those are some of the primary symptoms that we see.
And then if a person goes to the doctor with those symptoms, how is lung cancer actually diagnosed?
Initially through some sort of imaging, a chest x-ray or perhaps even a CT scan of the chest. If something is suspicious on that, then the next thing to do is to try to get a sample of that area that's suspicious so that it can be looked at under a microscope. And that can be done through a variety of means. Sometimes it can be done by coughing up a sample of phlegm. It can be done through a bronchoscopy, where a physician looks down inside your windpipe and into your airways with a fiber optic scope, and they can get little samples through that. Or sometimes it can be done through a needle biopsy, where a physician uses a CT scan to guide a needle into the suspicious area and get some tissue to look at under a microscope.
And then once a person is diagnosed, what are the treatment options there?
Sometimes surgery is an option if it looks like it's a small tumor and hasn't spread. Surgery sometimes can be done, and that can sometimes be curative. Unfortunately, as I said, lung cancer often presents late, and surgery really isn't an option. But there are other treatments. There are various chemotherapy treatments. Radiation therapy can be used. Some of the lung cancers are susceptible to radiation. And there are newer treatments that are called targeted treatments, where they use antibodies to attach to a chemotherapeutic agent that then goes directly to the tumor cells. And so there's a lot of exciting new research in treatment.
Very cool. All right, we're actually out of time for this segment. We need to stop and take a quick break, but thanks so much for all that information, Dr. Kunzweiler. Coming up next, when a person is diagnosed with lung cancer, getting the right care and support can be critical in battling the disease. We'll talk with a healthcare professional who helps make all that a little easier. Don't go away. We'll be right back after these messages.